Muskan is 16 months old, and for 12 of those months, she's been waiting for a heart operation. She and her parents have traveled a long way from the remote tribal areas in the north to get to this private hospital.
She was born with a hole in her heart. Sometimes her nails would go blue, and so would her eyelids. She would scream and then faint. I have no job now, and we can't afford surgery. We heard about this charity in Lahore, and they said they'd help us.
Farhan Ahmed started the Pakistan Children's Heart Foundation 3 years ago. His charity has paired up with hospitals across the country and covers all operation fees through donations. He's taken on this cause for personal reasons.
My daughter was born with a congenital heart defect. It was very difficult for us to even find the doctor. It took us about 3 weeks for us to find out that she has a congenital heart defect. Today she is no more with us, but her memories has kept me and my family to take this initiative forward.
Muskan is one of 50,000 children born with congenital heart disease every year in Pakistan. But she will be among the very few who'll undergo surgery and get treatment. Muskan is now being taken into the operating theatre. And for every child who gets heart surgery in a private facility, thousands of other children are waiting for a similar operation in government hospitals. And doctors here tell me some might actually die waiting. And this is why. Most of the children in this government hospital ward are in critical condition. Pakistan's public health system is overburdened with cases and severely underfunded. Only 3% of the country's budget goes to health. In a population of nearly 200 million people, there are only 8 practicing pediatric heart surgeons.
We work in a public sector institution where we see 100+ children coming to our institute every day. We can only offer surgery to 2 or 3 of them when 20 of them need surgery. And then you come into this equation of prioritization. And that priority of patients is sometimes which hurts you the most.
Back in the private hospital, Muskan's had a successful surgery. But the reality of Pakistan's poor healthcare system is that many other children may never get the treatment they need. Shaima Khalil, BBC News, Lahore.